Hey guys, and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be discussing deep vein thrombosis, okay, or a DVT. But first, if you could hit that subscribe button, it would be greatly appreciated as it truly does help my channel grow. So let's get started. So a deep vein thrombosis, or DVT for short, this occurs when a blood clot forms in one or more of the deep veins in the body. It's usually in the legs. So deep vein thrombosis, they can cause leg swelling, redness, pain, although sometimes they do go without symptoms. Okay, you are more susceptible for a DVT if you have certain medical conditions that affect your blood clotting, or if you're not moving for extended period of time. So for example, when you're traveling a long distance in a car, in a plane, or when you're on bed rest due to surgery, illness, accidents. So deep vein thrombosis, they can be very serious as it's a blood clot in the vein. So this can break loose and it can travel through your blood system and get stuck elsewhere. So some symptoms of a DVT can include leg swelling, leg pain, cramping, soreness, and it often starts in the calf, okay? You can also have changes to skin color, such as reds or purples. You can feel a warmth on the leg, and sometimes there's no noticeable symptoms at all. So if you're having these symptoms, definitely seek medical attention, but honestly, sometimes there are no symptoms. So if you notice symptoms of a DVT, you want to contact your health care provider right away. But then also, sometimes because we don't have symptoms, I just want to kind of give you the warning signs of a pulmonary embolism. So if a clot breaks loose and is traveling through our blood system, it can end up in our lungs. So, and that is a pulmonary embolism. Okay, so I have included the warning signs and symptoms here. So sudden shortness of breath, chest pain, discomfort that worsens when you take a deep breath or when you cough, feeling lightheaded or dizzy, faint, a rapid pulse, rapid breathing, or coughing up blood. This is a medical emergency and you would want to seek emergency medical assistance. So the causes of a DVT. So really anything that prevents the blood from flowing or properly clotting can cause a blood clot, okay? The main causes of a DVT are damage to a vein from surgery or inflammation due to an infection or injury, okay? Okay, so there are many risk factors that can increase your risk of having a DVT. So we'll start off with age. So just being over the age of 60 increases your risk. Lack of movement, injury or surgery, pregnancy, birth control pills, being overweight or obese, smoking, cancer, even some cancer medications can increase your risk of blood clots, heart failure. If the blood isn't pumping properly, this can increase your risk of a clot, inflammatory bowel disease. A person with a family history of a DVT or a pulmonary embolism, okay? So if you have a family history of that, you are at greater risk. And just genetics. Some people have the DNA changes that causes their blood to clot more easily. So once again, some complications. So pulmonary embolism, like I spoke about before, it is a potential life-threatening complication when associated with a DVT. You would want to get immediate medical help if you have any of those symptoms. So once again, shortness of breath, chest pain while breathing or coughing, rapid breathing, rapid pulse, feeling faint, and coughing up blood. Now, there's also post-phlebitic syndrome. So this is damage to the veins from the blood clot, reducing blood flow in an affected area. So symptoms include leg pain, leg swelling, and color changes to the skin or skin sores. So this is when you have a blood clot in your leg and it's giving you pain in that leg due to the damage it's causing and the reduced blood flow. Okay, and then we have treatment complications because DVTs are treated with a blood thinner. Okay, now when we take a blood thinner, it thins our blood. We are at risk of heavy bleeding if we get cut. Okay, so it is super, super important that we have regular blood tests to ensure proper dosing of our blood thinners. So some prevention to reduce the risk of a DVT. So certain lifestyle changes can help prevent deep vein thrombosis. So you can try these strategies. So just moving your legs, kind of that pumping to get that muscles contracting. So moving your foot up and down, that will help contract the muscles, moving the blood. Okay, especially when you're traveling, you want to make sure that you're stretching your legs, stand up, walk if you're on a plane, just do like an occasional stroll around. If you're traveling by car, just stopping every hour or so to take a little bit of a walk, get that blood moving. Smoking. So smoking increases the risk of a DVT. So if you smoke, you could stop smoking, and that would help with a bunch of other problems also, but it will reduce the risk of a DVT. Managing weight. So obesity is a risk factor for a DVT. So just regular exercisers lower your risk of blood clots. Okay, so at least 30 minutes a day, moderate physical activity. So I hope you did find this video very helpful, and I hope to see you all in my next video. Bye, guys.